This week, let's look at how you can move from I dabble in POCUS to I really depend on it. And last week, we focused on the barriers that hold you back. Things like lack of time, uneven training, inconsistent practice, limited feedback, and lack of a clear routine. And the takeaway was simple, that really your confidence is going to grow when practice is structured, small, and repeatable, not when it's one big, heroic, perfect event. That leads to the question then, structure towards what? And what does progress actually look like at the bedside? Most clinicians that use point-of-care ultrasound, they're not chasing perfection. They're asking a focused question. So then you have to ask yourself, when is a POCUS scan good enough that you can trust it at the bedside? It doesn't have to be a flawless image. It doesn't have to be an exhaustive, comprehensive study. It just has to be clinically sound and help you to answer that clinical question. Now, one of the myths is that POCUS should only be used by experts. Again, we have to differentiate the comprehensive study from the POCUS study. Again, when you're doing these studies, it's laser focused. You're answering specific questions. Clinical excellence does not come from waiting until uncertainty disappears. It comes from learning how to make sound decisions in the presence of uncertainty, or minimizing it through the addition of these bedside tools such as POCUS. When we look at what a working definition of a clinically sound POCUS exam is, I think it's when you have a couple conditions being met. Number one, image acquisition. The image is technically adequate and interpretable. It doesn't have to be perfect. From an interpretation standpoint, that you can reliably distinguish normal from the clearly abnormal findings and clinically relevant. The scan meaningfully informs you about the clinical question and helps you then to move to the next step. When performing these scans, you therefore want to ask yourself, what is my clinical question? If you don't have a clinical question, this is the slippery slope of a POCUS exam. Then really, are you doing a comprehensive, exhaustive study? Once you do the exam, and assuming you have a clinical question, you have to ask yourself, did it address and answer this clinical question? You're looking at also, was the image technically adequate? And does this help you to move to the next step? And does it change what you're going to do? If the answers to these questions are yes, then this is a clinically sound POCUS exam. When we look at the bigger picture, clinical excellence is built through repeated, thoughtful decisions made with clear boundaries. Clinically sound POCUS, again, it's about answering that focused question. And that is the important thing. It doesn't have to be a perfect, comprehensive, exhaustive study. So let's look at where we've been and what's next. Remember, you're not behind. This system has been really challenging for clinicians to integrate POCUS. And we've seen this over and over. The real barriers that you're going to get, they're operational, they're not personal. These are things that are flexible and you need to learn how to integrate into your own practice. And the confidence, it grows fastest when expectations are clear and achievable. And that means you remain focused and you keep in mind that you're trying to answer a specific clinical question. So next week, we'll zoom out a little bit and we're going to look at POCUS and how it's no longer a niche thing. It's really mainstream. We've just gotten started. And in 2026, we're going to see things take shape even more as we look at the different specialties. So again, Thanks for being a part of this POCUS focused community. And if you have any feedback or comments, we would love to hear that. If you're looking for more structured support, our emergency medicine and hospitalist flagship courses are now available, and you can explore them by clicking on the links. So until next week, bye.